Dr. Patrick Kuma Abuaje, who is here with a very powerful delegation from the Ghana Health Service to provide updates on their mandate, the introduction of network of practices, and also the National Malaria Elimination Program. But before I yield to the Director General and his team for their remarks and respective presentations, permit me to acknowledge some dignitaries who are with us this morning. I would like to start by acknowledging all the regional directors who are watching us online via GTV or Ministry of Information, or watching us via the Station of the Nation GTV. We also acknowledge the deputy directors and staff of the Ghana Health Service. Also, we would like to acknowledge the Director, Human Resource Division of the Ghana Health Service, Mr. Obri Yeboah. Also with us this morning is the Director, PPME, Dr. Alberta Brichum Nyako. We are also joined by the Director, Internal Audit, Mr. Frimpong Boateng. Also with us is the Acting Director, Institutional Care Division, Dr. Ofori Boedu. This morning we are joined by Director, SSDM at the Ghana Health Service, Mrs. Araba Kudiabo. Also with us is the Program Manager, National Malaria Elimination Program, Dr. Kezia Malva. Also with us is the Director, Public Health Division, Dr. Franklin Asiedu Bequin. And as I mentioned earlier, we have with us the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaje. On that note, I would like to invite the Director General for his introductory remarks, and then we will come back to you for the next segment. Thank you.
Thank you, Honorable Deputy Minister. Good morning, all. Directors of the Ministry of Information and the Ghana Health Service, friends of the media, we are happy to be here to share some of the work we are doing with you, and also take the opportunity to introduce some innovations that we are doing, because you need everybody's support to be able to achieve them. But I'll start by just reminding us about the mandate of the Ghana Health Service, which is extremely important that we're all on the same page. Our mandate simply was to develop and promote policies, guidelines, strategies for the delivery of healthcare services in Ghana. And we've primarily focused on providing accessible, equitable, and affordable healthcare to all Ghanaians, especially in the poor and vulnerable people of this country. And so primary healthcare becomes very, very core to our mandate, making sure we provide services to the people as close to them as possible. We are also to ensure availability of essential medicines, medical supplies, promoting research and development in the health sector, and also provide training and capacity opportunity for all our health workers so that we can deliver services better. But through the various programs and initiatives, the service is working to improving our health of Ghanaians and achieving the sustainable goals, which we have just 7 more years to reach 2030. Our mission is also to provide and prudently manage comprehensive and accessible health services, with particular emphasis on primary health care at the regional, district, and district levels, and also provide secondary care in accordance with national policies. We are here to pursue the mandate to promote our healthy. In pursuing this mandate, we seek to promote healthy population with universal access to quality health services. In all this, I will just talk briefly about what we are here for. We are here to show you, as I said earlier, some of the key strategies that we are employing to achieve this, especially some of the innovations and some of the targets we set for ourselves to look at. We're also here to also share with you some of the achievements we've had in the last few years. And before I introduce the other technical person to provide the details of the two key areas we are looking at. We'll be looking at improving primary health care through an approach we call the network of practice, which you get the details. And then Ghana has also reached a stage that we are taking a bold step to eliminate malaria. And that will be the core. But in the meantime, we just want to praise you that in the last few years, we've been able to reduce maternal mortality, neonatal mortality, and under 5 mortality. Our institutional maternal mortality has dropped from 875 deaths in 2018 to about 809 in the 2022. And this, for mortality, looks like not a very significant reduction, but for maternal mortality, that's quite significant, especially when our deliveries have moved from about 9,000, has increased over the years by about 13%, and we still are able to maintain a significant reduction in deaths. Our stillbirth too has also reduced significantly. And like I said, our total deliveries have increased by 13%. And so when you have that, and you have a fewer number of stillbirths and fewer maternal deaths, that is show that some improvement in the service delivery. Malaria, which you get details, malaria deaths have dropped significantly in the last 5 years, from 1.42 per 100,000 to 0.45 per 100,000 in the last 5 years, and that tells you that was a very significant reduction in care. We have also improved our supply chain system through making sure it is visible through our guildmates so that we are able to see in real time where supplies are, where we are short or where we are overstocked. And so this is also an important area we will talk about. And it's gone as far as from the national level to the CHIPS compounds where we are able to visibly see our supplies. We have also been able to improve our e-health system by ensuring that the e-tracker, which gives us real data and detailed data, not just the summary data, and also electronic medical records through the Lightwave Health Information System, has also been introduced across the country. To improve the status of health, not just of adults, but also adolescents and also our future leaders. We have introduced significant programs in adolescent health. The last one was the YOLO program, which seeks to improve the health of adolescents and also reduce the risk approaches that they take as a group. We have continuously improved our public health emergency response system, and we are actually appropriately responding to emerging and re-emerging diseases. Of late, you've noticed how we are able to respond quickly to Marburg, Lassa fever, yellow fever. All these outbreaks have come in, which we are probably not as prompt as we are. But currently, most importantly, we have been able to establish e-surveillance, which means that we are able to, in real time, share information to across the country to covering about 70% of all our points, are able to respond quickly. So as soon as there's a death or there's an outbreak at the national, district, and regional level, in real time, we are able to know, and that also helps us in our response. We have also expanded our port of entry through increasing the lab capacity, port of entry services. We have created offices there. We have also put our ambulances in our major port of entry, I mean the land borders and the airport, so that we are able to respond appropriately. We've also increased our laboratory capacity with P3 labs, about 4 of them across the country, not just in Accra, Kumasi, Ho, Sunyani, and of course, Northern Region. So these are all areas that we have made improvement. Most importantly, in the last 3 years, we have been able to recruit up to about 33,625 new staff to boost our capacity. And so we have moved from 86,000 staff to about 120,000 staff as at half year, June 2023. Definitely, we've suffered with a brain drain. By looking at the numbers, in terms of the absolute numbers, we are not affected. We have lost experienced people. We have lost some skilled staff, but we have also put in a system to make sure that in the next 2 years we are able to replace them with further training and recruitment. So, in the last 1 year, I think we lost about 525 or so nurses. But of course, currently, despite the 120,000, we are currently having recruitment of additional nurses across the country. We've been able to send doctors to the rural areas, but we want to use the opportunity to encourage communities to put in systems that attract skilled staff to their districts and their communities to offer care. So in our unwavering pursuit of attainment of universal health coverage by the year 2030, we remain a focal agenda. The service has revisited a strategy to strengthen primary health care and deepen our collaboration with partners towards the redesigning of the primary healthcare system to improve the quality and provide more patient-centered care. The details will be given to you. So in this vein, a project or a program called the Network of Practice with the Model Health Center as the fulcrum, that is a health center which will be explained to you later, has been introduced and will soon be launched in all regions and districts. This strategy and network would increase access to care at all levels of the health delivery system. We will continue to engage stakeholders as part. This is one of the efforts to engage stakeholders and bring this to Ghanaians to see the things that we need and how we also want their collaboration to expand access to care, especially at the primary level and at the levels where people are vulnerable, people where previously we were not rendering appropriate care. This will also help us to look at that. So, as I end here, we'll now ask the Director Policy, Planning, Monitoring, and Evaluation to now give the details of what we call the Network of Practice, after which the malaria program, which also benefit from the structure, will help us lead us into the elimination of malaria in Ghana. Thank you very much.
Honorable Minister, ladies and gentlemen, please allow me to stand on existing protocol and explain what the networks of practice is all about. So I shall start the story by talking about what the networks of practice is, the challenges or the problems that we think this new approach is going to solve, how the operations would be done, and then the benefits to all of us as people living in communities in Ghana. So as the Director General rightly said, the networks of practice is a new approach that the Ghana Health Service is introducing to ensure that we strengthen the primary healthcare service that we have been providing for several years in the country. So it is a new model where we intentionally or deliberately link up already existing health centers, hospitals, facilities, CHIP zones, maternity homes, and such in specific geographic areas so that they are able to provide better service to the people of the community and by extension, all people living in Ghana. So what are the networks of practice? It is a specific arrangement between public, private, faith-based organizations or facilities that provide service delivery to the people in the communities. And we are arranging these networks so that together they are able to provide better services to the clients who patronize their services reduce unnecessary deaths, and also ensure that we rapidly and appropriately respond to clinical and public health emergencies wherever they happen. These networks shall be arranged as hubs and spokes, meaning there would be a bigger entity that is the main facility that provides more support in terms of human resource, the capacity to see certain diseases, better equipment, surrounded by satellite facilities or spokes or smaller health centers and clinics and CHIPS compounds that provide support to each other, either at the peer-to-peer level or receive support from the main hub. The main hub that the Ghana Health Service wants to use is the health center. So the goal of the networks of practice is to increase access to quality services for everyone in Ghana. We have been talking about primary health care in DG's opening remarks, and I think I've also mentioned it here or there. Primary health care simply is the essential health service that anybody needs when they are ill. And this is the service that must be tailored towards your needs, whether you are a child or you are an adult, a male or a female. And as much as possible, this service must come to your doorstep, meaning wherever you are, every day in your routine life, you must be able to access primary health care when you need it. Here in Ghana, primary health care is arranged in a 3-tier form. We have the district level, the sub-district level, and the community level. At the district level, we have district health management teams, which also includes the district hospital, and they work closely with the local government authority and other sectors of government in terms of planning, monitoring, coordination, and the provision of clinical and surgical services to members of the community. At the sub-district level, which is often led by a health center, it is also the provision of clinical services and public health services as appropriate. And the last level, or the lowest level, is the community level, where we have health workers who are working in tandem or closely with community members to plan the health services that they need and also help improve the health of the people at the community level. So at the community level, that is where we have the CHIPS compounds or the CHIPS zones. And in the sub-district, that is where we have the health centers. I must say that when we do an introspection or assessment of the services that we provide, we have noticed that the sub-district level is the weakest, or the health center. And that is why we are trying to use the health center as the hub in this service redesign that we are doing, so that we can lift up the game, so to speak, of health centers and make sure that they operate at standards. Looking at the situation as we have now, we believe that the sub-district level, or where the health center is, can be improved in a lot of ways. And that is what the networks of practice seeks to do. We want to ensure that going forward, health centers are able to provide 24-hour services and not just close around 2 p.m. We also want to send doctors to the health centers and to the CHIPS zones, that is in the sub-districts, to augment the quality of services that we provide. So people will no longer have to always go to the district hospital level or above before they are able to consult a doctor. A doctor can now come to them. It reduces their cost and also gives them better quality services. Also, we are improving the feedback system. Whatever services we provide to you, the precious people of Ghana. And we always need feedback from you to know whether what we are doing is meeting your needs. So we have quality improvement approaches like the community scorecard system that makes us periodically get information from the community as to how we can better serve their health needs. This has largely been present at the community level or the CHIPS level, and with this new approach to improving our services, we are making sure that these accountability tools are also present at the sub-district or health center level, as well as the hospital. We are also going to expand the kind of services that we provide at these model health centers, ensuring that if they were previously seeing only about 8 or 10 types of diseases or conditions, they can expand beyond that. Because of that, we are increasing the numbers of health staff that we send to these model health centers, as well as the staff mix, and also training them to ensure that the things they were not previously able to do, now they are well trained to do them. All because we want to give better quality services to the people of Ghana. We are also intentionally going to ensure that where equipment are lacking, we provide all these equipment. We are going to improve referrals such that only those who need to go to the higher level will go. We are not going to send patients to the next level just because we do not have one little thing or the other. We make sure that resources are available at the sub-district level or within the networks so that we do not worry patients to go up and down when it is not required. However, staff would rather go up and down to meet the needs of patients. We want to reduce fragmentation of services in the system, and as the DG alluded to, ensure that the logistics management system that we have works and is sustainable at the sub-district level. We believe that a lot of cases are seen at the district hospital level, which perhaps need not be seen at the district hospital level if our health centers are working optimally. And that is why we want to upgrade the health centers into model health centers so that they are able to meet the needs of cases, especially that which is uncomplicated, and save our clients and our cherished people the burden of trekking all the way to district hospitals, the money, the time, the inconvenience. It saves them money and time. Invariably, it also saves the government. And when we are able to take care of the cases that we are supposed to take care of at the sub-district level, then we do not overburden the district hospital, and the district hospital staff can also give better quality services to those who go there. This is how we expect that the networks will be arranged. We are using the health center as the hub or the fulcrum around which satellite centers or spokes will be arranged. But even if there's no health center and there is a private facility that has agreed to work with government, we can use these private hospitals also as the centers or the hubs. So all these networks will still be connected to the district hospital because the district hospital has direct oversight over these networks. The doctors there will move also periodically to the sub-district to augment the staff strength and also to train on site and see cases. So the district hospital, the district health administration, supported by the local government system, will ensure that these networks are functional and sustainable. So it is not only an arrangement between the health facilities at the sub-district level, but we are linking up with all those who provide health service in one form or the other. So it includes the National Ambulance Service. It includes telemedicine or teleconsultation, where we can call seniors to ask them, how can I better manage this case? What should I do for this emergency case before I refer? All that will increase the quality of the services that we provide. It includes chemical sellers, community pharmacies, sick bays in schools, other health facilities, the CHIPS compounds, some health posts in marketplaces, some infirmaries in workplaces or factories, and all that in between. We are not leaving anybody out because we believe that we must use a whole of society, whole of government approach to improve the health of the people in Ghana. When we build these networks, we are able to provide seamless service. Staff can move from one point to the other to support the care where it is needed. And we also share resources so that our patients invariably do not suffer. The health centers, I said, would be the main fulcrum where they are going to be upgraded into model health centers. These upgrades would also include some improvement in infrastructure to ensure that if it comes to maternal care or newborn care, we have appropriate places to provide these services. It also includes human resource improvement, having physician assistants, midwives, other technical officers playing the role they are supposed to play, and also doctors, as I mentioned before. It will also zero in on emergency care for pregnant women, newborns, what we call basic emergency obstetric care, so that we do not lose mothers and newborns at the time that they really need critical interventions. We're also going to pay particular attention to non-communicable disease care, especially the uncomplicated type. So hypertension, diabetes, screening for some cancers like breast cancer, cervical cancer, providing mental health services, rehabilitative or physiotherapy services. All these will be provided at the Model Health Center, and we're going to give 24-hour service provision. There would be regular activities of these networks, which is not very different from what they are doing, but it would be strengthened, it would be improved, it would be better. They plan together, they learn together, they give home visits, outreaches, derbers, they refer patients and also track the patients that are referred. Not only those who are going to the bigger hospitals, but those who have been stabilized at the bigger hospitals, who have been sent back into the community, will also be followed up as appropriate. We have had pilots of this approach that the DG is leading, and we saw that it gave us the expected results. The deaths we did not want to see actually reduced. The good things we wanted to see in our service provision, improved coverages, were also experienced. Better referral systems, better experiences for our clients, and all that in between. And therefore, we believe that it is a winner, and it's going to help us give better services to the people of the country. We believe that at the end of it all, our services are going to be the way that we want it to be. You, our clients, are also going to be satisfied with the kind of service that we provide to you, and that would be what we want as a service for the country. What would be the benefits to you and I, as we are all community members? This new approach is going to bring quality health services closer to us, wherever we are. It will also reduce the burden on individuals, families, and communities as they seek health care. We're going to have 24-hour service provision at the sub-district level. The staffing levels are going to improve, as well as the quality, so we'll get better and quicker services. Outreaches from the hospitals to the sub-district would help us. Actually, that would be the icing on the cake. So there would be better experiences, whether it is for referrals or it's for care at the sub-district level. And we also believe that there would be reduced costs for our clients. In summary, the networks of practice with the Model Health Center is a new approach that the Ghana Health Service shall soon roll out. It is an approach to improve client experiences as they come into the health service seeking improved service delivery. And you, yes, you are the center of this new approach. And therefore, you have a say in how it goes. That is why we are using the accountability measures for you to also give us feedback as to how we are serving your health needs. And everyone has a role to play. And so we use the offices of the Honorable Regional Ministers, the district assemblies, traditional leaders, the clergy. Everybody has a role to play, so that when you go to a particular facility and they tell you that we can take care of you here, believe in us and do not go of your own involution to the district hospital or the regional hospital. We'll make sure that your services and your needs are met when you come to us. So we say, help us to support you. Thank you.
Thank you so much, Dr. Alberta Brichum-Nyarko. That was such a brilliant presentation. I was thinking about the sub-district aspects of the presentation, and I was telling DG that it borders on our communities, especially the rural communities, so there may be the need to do a Chi translation of that part for them to really understand. Opinion of free Ghana Health Service. Obejina hansem bebre na waka ni tichiu. Ene say kwan ya omofa so gi ayarehwe ne nkita hodie no omo pese omo hye mukina ni tichiu ene health centers ne chip compounds a ewo ye nkro nketoa ne akamu na ede ade no omo pese omo ye omo say etese nka ntete na okọ health center ebi omu bia na pa no nwotwe ebebo awia no mienu na omapon Almost the same. She share omo de bano and the network of services in the yen ne saa bio. Omo pese omo yen hyehyɛ a eye health centers nature compounds no ombeye adwuma 24 hours a day. Enye no nko a omo pese omo de akade ne se no mbesi asiesie ho aye nhyehyɛ afa ama wokɔ hɔ no ma ete se ne wakɔ district hospital anaso wakɔ hospital kese emu na enu nto omo ba be omo de a doctor for bekɔ health centers no na chip compounds no omo de a nurse for ne midwives ene adwumayɛfoɔ dodoɔ na abɛkɔ hɔ ahyɛ hɔ no adwuma no mu kena ebi onso so ete se yare a na omo hwɛ wɔ hɔ na ɛyɛ bɛyɛ sedu a omo de bi bɛka ho ama yare bebree kwa na wokɔ centers na wotumi kɔgye ayarehwɛ enti se model health centers na omo de ba no enye te se o ye baby a ye mi akuro ana se ye kɔ weyi nko a da bi omo de bebree kwa nema bebree ni hyehyɛ bebree kwa akeka ho a se no omo ye asiesie ni wie na se ye ka se yare we de ehu ihia se obetua ka sika se me kokro kese mu na makɔ akɔdi line the whole day or district hospital enka ukɔ health center hɔ na eye ayarehwɛ na obetima agye no wɔ hospitals akese mu no saa bi na nketoa no nso so ombetimi ahwɛ ama na medi sikura no ɔse ebio Oma ye hub bi ebeboa ama nkitahudie between the hospitals any wo sick bay wo school anase edwam anase wadwumam anase omo ye licensed chemical sellers ne pharmacies wo communities mu nyina omo do mu nyina ebehye network bi mu a ebema omo nkitahudie na kosoro enti no wo de yare na enye huhuhu no eco health center honoma ombetima hwe hu bibia omu ntimi ano omo beka se omo de beko hospital akese mu no wan dance wadaje entu yakeska ankwa ankotwa kwan enti nsem na okan no na posu bi na media ma no. On that note, ladies and gentlemen, we will move to the next part of today's press briefing, which has to do with the National Malaria Elimination Program, and we have with us Dr. Kezia Malva to take us through that presentation.
Thank you very much, Honorable Deputy Minister. Yes, I'm Dr. Kezia Malva. Thank you. So, standing on existing protocols and piggybanking on the presentation from Dr. Brichumal Nyakon, I'm here to enlighten you about Ghana's malaria elimination agenda. Yes, as we improve the networks, as we try and improve the quality of service, you know malaria is number one. So through that effort, we also want to push the bar higher. The mandate of the National Elimination Program under the Ghana Health Service is to lead all malaria elimination efforts in the country. And we do that by coordinating activities of all agencies and partners with the vision that eventually Ghana will be free of malaria. Our mission is to ensure that the entire population of the country has universal and equitable access to the interventions for malaria prevention and treatment. And by so doing, we will be achieving progressive subnational elimination. It's not news, and usually sometimes we say normal malaria because it's been with us forever. Unfortunately, it is the major public health and socio-economic problem in our country, a leading cause of morbidity in Ghana, particularly in children under 5 and pregnant women. Ghana, unfortunately, is one of the 10 high-burdened countries in the sub-Saharan Africa, and indeed in the whole of the world, accounting for about 70% of the global malaria cases and deaths. And in Ghana, it is the highest disease expenditure under the National Health Insurance Scheme. It costs the country 6% of our GDP. And in fact, this 6% cost has been estimated for quite some time now. It's accounting for a lot of loss of work days. Usually when people are sick with malaria, it may count for 1 to 9 work days in the year. And Caretakers also lose their days at work because a child is sick of malaria. In the past, around 2002, we had an estimation of the malaria parasite prevalence, and it put the country at a prevalence between 50% and 75%. Some places were 50, others were as high as 75%. That means if you take 100 children under 5, 100 children under 10 years, you get about 7 of them being positive for malaria parasite. The story has changed over the years. In 2011, the prevalence was around 27.5%. I think my DD loves this slide very much because it just shows that we have come far. Last year, when we did the demographic and health survey, we were at 8.6%, a great improvement from the previous years. The story is the same. It's been highlighted earlier on. We were looking at 14% of people dying from malaria, people who fall sick. So if 100 people fall sick, 14 of them were dying of malaria. That has drastically improved. Now, as at 20, this figure on the graphic is 2012. If I had added, it would be too long. But in 2012, it was around 0.6%, under 1. And in 2022, it's come to as low as 0.45%. That's the earlier graph is the figure we see at the health facilities. If you extrapolate that to the population, the picture is no different. We've seen a considerable and significant decrease in the number of deaths in our health facilities. So in summary, we have made progress since 2000 when it comes to malaria. It is the number 1 cause of outpatient attendance, but a lot of progress has been made. We have reduced the parasite prevalence in the country, about 82% reduction from 2002 to date. We have reduced the number of deaths that we record in our health facility. And this is in a situation where our health facilities have increased, our recording and process of recording data has improved. We've reduced the deaths from 6,000 to just around 150 in our health facilities. And case fatality continues to reduce. That is why we believe we can eliminate malaria. And just to situate what elimination is about, I'm going to go through some definitions. So we've been controlling malaria for a long time. And when we say malaria control, we are talking about reducing malaria morbidity and mortality to a level that is acceptable through deliberate effort, through the scale-up of preventive and curative tools. I'm not sure which level will be acceptable to us. So we decided that no, we have to move to another level, and that's elimination. Elimination basically is having no incidence of locally acquired malaria infection in a geographic area from deliberate efforts to prevent and also to prevent re-establishment of transmission. And recently, the world has introduced a subnational elimination, which is targeting elimination progressively starting from parts of a country. So I know there are people, when they hear about elimination, say, it is not going to be possible. How? Every day we are getting malaria. But we believe it's possible because we are going to do it subnationally, progressively targeting parts of the country. And what have we done so far? So in 2022, 2022, there was a unanimous call by partners to push the elimination agenda. We had a political will. We actually inaugurated the Parliamentary Select Committee on the Malaria Caucus. It was actually inaugurated by the Deputy Speaker of Parliament. You can see some pictures there showing what was done. Under the Minister of Health, the program's name was changed to highlight our efforts from control to elimination. That's why the program was introduced as the National Malaria Elimination Program. We did an audit of ourselves to see what we've done right, what we can do better, and what are the gaps. We engaged a lot of stakeholders, And with that, we have just developed a strategic plan which we'll be launching very soon under the auspices of the presidency. I'm going to highlight a bit of the strategic plan to see so that you know what we are going to do in our elimination efforts. We basically have 3 goals in the plan. The first is to reduce mortality by 90% by 2028. I'm hoping that by 2028, whoever will be presenting the malaria statistics would be mentioning numbers in the zeros or in the single digits. We also want to reduce incidence by 50%. Incidence of malaria, I'm talking about the parasite prevalence and the cases we see in our facilities. And we want to push 21 districts towards elimination by 2028. 21 districts because currently they are at very low levels of malaria. Subnational elimination is what I mentioned, and this is just what we are going to do. Using our malaria incidence, our prevalence, our mortality rates, access to healthcare, and that's where network of practice comes in, because it is key in ensuring that our elimination agenda is attained. We zoned the country out. Currently, we are going to move in 4 zones. We have the very low zone, which is shown on my slide as blue. Yes, I think it appears as blue on the projector as well. And then we have the low zones, which is showing green. I think on the projector, here it shows darker blue, but there it's green. So between blue and green, it's all the same range of colors. And then the yellow one is the moderate transmission areas, and the orange one is the high transmission areas. So malaria is not the same across the country. Some areas are much lower than the other areas. So we'll be doing things differently in these areas. For all the zones, we'll continue some of the activities that we have been doing, which includes quality case management of people who fall sick from malaria, intermittent preventive treatment of malaria in pregnancy. We have the indoor residual spraying, we have the insecticide-treated nets. We also continue with the larval source management, behavior change communication, our surveillance on epidemiology, and so the mosquitoes and the diseases as well, research and effective leadership and management. For the very low areas, we'll be introducing some new intervention stepwise. So we'll be doing what we call mass drug administration. Other medicines will come into play, and will enhance the surveillance with our mosquitoes and our disease in these areas. I'm sure we'll get to a point where if one person has malaria in such an area, we'll go around the household, like we did during the COVID time, where we did the enhanced contact tracing, to be seeing who brought the malaria in that area and make sure that we nip it in the bud. For the moderate to high transmission, we'll continue and expand indoor residual spraying, seasonal malaria chemoprevention, which we currently do in 7 regions in children under 5. We are actually hoping to expand the age range to older children, and malaria vaccine, which is one of our new babies that is growing on the block. Currently, we are doing 93 districts with the expanded program on immunization. We will be expanding even further as we move along. And the new thing is that now when you get malaria very soon and you are admitted and you are going home, we'll just not say you are fine, just go. We'll be giving you additional medicine so that you don't get back to where you were. Indeed, if we reduce malaria and we are able to eliminate it, it will give us a lot of gains. We believe that with all the efforts, we'll be able to avert 86 million malaria case episodes by 2030. We'll be able to avert over 4,000 deaths of malaria, and the economic benefit is quite enormous. It's estimated around $32 billion. The economic benefits exceeds the cost of malaria control by as huge a number as 22. So it would, if you look at the money that we'll put in eliminating malaria and compare it to what we'll gain because of people going to school, people going to work, not spending so much on admissions and treatment, it's 22 times that benefit. But if we relax and we let us go back to our old situation, it will be worse than what we are seeing now. We'll be getting 39 million additional cases, over 2,500 additional deaths, and it will cost us much more if we retrogress our efforts in malaria. What are we expecting? Indeed, today we are here. One of the reasons we are having this presentation is to call all partners to support us in this fight. We can't do it alone. For our political leadership, we are asking them to keep malaria high on the political agenda, advocate not just at the national level, but at the district, regional level, so that we have the needed resources. The resources do not all have to be money. I think all the other things that we do in terms of enlightening people for them to understand that malaria efforts depends on you and me. We hope they'll be launching the plan soon, and at the launch there will be a committee or a task force that is spanning across all ministry, because malaria elimination is not just the job of the Ghana Health Service or the Ministry of Health. We'll be calling on our chiefs, assemblymen, to enact and implement laws that will prevent people from abusing the tools that we have, and also pushing the communities to do their part when it comes to elimination. I've mentioned a bit of what we expect other ministries to do, so I'll skip that. To the community members, we want all community members to use the preventive interventions. We have nets, we distribute. There are areas we are doing indoor residual spraying, so it means you have to open your homes to people to come in, give medications, and when you are sick and you go to the hospital, you follow the treatment. The medicines are usually so good that people finish day one and they forget. But what happens is that you are just making the parasite become stronger to fight the disease. We'll be working with the research institutions to conduct research to answer questions that we have, to fill in the gap, to make sure that whatever we are doing is based on data, is based on information that has been researched. And to the media, our partners in everything that we do, we want you to carry the message of elimination, the message of what people should do to eliminate. Help us make sure that we give the right information, dispel rumors that will send us in the other direction, because when malaria comes, when we don't eliminate malaria, when there's malaria, the mosquito will bite me, it will bite you. It doesn't discriminate. So we all are in this together, and we hope that the private sector will also help us in providing resources. As we are coming to the end, just to let you know that it is possible for us to eliminate malaria. So in this graph, the purple one on top, the bar on top, shows that if we relax, malaria would continue to increase. If we do what we are doing now and we don't add any other thing, it's the blue bar which shows we will just be lingering around the 10 million cases throughout the whole year. So if we just do what we are doing, we are not going anywhere. But if we improve the efforts and make sure that the new interventions that we are going to bring are implemented, we'll see a great reduction. That shows us the green bar going down. But if the health systems, in addition, are improved, if things like network of practice, we all support it for it to be done well, then the bar will be the last one at the bottom, which is orange on my slide, and that will eventually get us to eliminating malaria. So indeed, malaria elimination is possible. We just need a bit more focus. Let's all work together for a malaria-free Ghana. Thank you for your attention.
Dr. Kezia Mal, thank you so much for that insightful presentation. On that note, ladies and gentlemen, we will invite your questions. If you have any question, you can show by hand, mention your name and affiliation, and then proceed to ask your question. Okay, ladies first. As I've seen someone at the back. Okay, we take the second starter. Okay.
Thank you very much for the presentation. Quite insightful. My name is Esther from Metro TV. I want to find out with the malaria vaccine. The last time we heard of it, it was accessible to children from 5 months to 3 years. I want to know if it has been extended to older children. And also, the Director General mentioned the issue of brain drain with nurses leaving abroad, if I'm right, that's what he meant. And he mentioned that they were trying to do something. I didn't catch that part very well. But are there some frantic efforts being made to curtail that? Or we think that it's not something that can be controlled because we'll be recruiting more nurses? Yeah.
Okay, thank you for the question.
My name is George Credit, and I report for TV3. And my concern regards the brain drain the Director General talked about. And clearly, it seems the major reason why these nurses leave the shores of Ghana is for greener pastures. And so if you're trying to just avoid that, we'd have to meet them halfway. So what exactly is the Ghana Health Service doing to ensure that we stall this very process? And also my second concern is about the black flies infestation, and what is the update on that very infestation? Thank you.
Thank you for the questions.
My name is Ataminsa from Ghana News Agency. Yes, Dr. Alberta talked extensively about a network of practice and plans to improve primary health care by establishing more sub-district health centers to improve health care. I was thinking about, it's a very laudable idea if it is well implemented, but I'm looking at the cost. How much is this going to be implemented in terms of the cost? Because as a country, we are told we are suffering financially and we have to seek support from outside. And so looking at improving infrastructure, training of personnel to implement these things, I'm looking at how much is going to cost the nation to implement it. And if there's any support from outside, maybe World Health Organization or any other institution that's coming in, then when exactly is this policy going to be implemented? Thank you.
Thank you for the question. We can take 2 more questions if there are any hands. If not, I will invite DG back for his responses.
Thank you very much. I'll give some responses, and then I'll also ask Alberta and Kezia to also come and top it up. I was suspecting that brain drain was going to take a center stage, but I think we also can talk about the malaria elimination and network of practice. Brain drain, like you said, the second questioner said is greener pastures. So obviously, where the green is, I don't know which country in the sub-region, this sub-region, is going to be able to compete. But one thing we forget is also that we don't appreciate the people who stay. I think we also have to, as we ask for them, we must also focus on the people who sacrifice to stay. So in terms of numbers, we are losing not only nurses, we are also losing some doctors as well. The effort of the service and everybody trying as much as possible to, as it were, improve conditions of service continues. Ghana Health Service have non-financial incentives where you are promoted out of 10 because you are in a deprived area, where you are allowed to further your education because you are. These are all additional things that we can. But we believe that the communities and everybody, media, can advocate for additional support to encourage people more to stay and also make them treat better. We know that it is almost impossible to virtually stop that from happening. We've seen it before. If the Western world needs 500,000 health workers to boost up, it's a cycle. It will get to a stage, they will fill up, and it will stop. What the survey has done is we realize that we're looking experienced hands, we are looking some of the other professional nurses. And so what we've done is, since the last 2 years, is virtually double the amount of people, the number of people who go for steady leave, so that in the next 2-3 years, we'll be able to recover whatever we lost. But in terms of absolute numbers of staff, we have not seen any impact. What we are seeing is that some professionals are leaving. The cost of care, for cost of the NOP. Let me show you one of the things that is going to happen. One of the things is that on the average, you're going to upgrade about 400 to 500 health centers into the network of practice, where we have a structure, whether you have a minor theater, they have some consulting rooms, to make it able to run 24/7, putting additional staff. So what it means is that we are going to have to rearrange our health workers. Now we're going to post them to the sub-district, and so that you may be working in health center A today, but because there's a market day next week in this one, that's where you're working, so that we can share staff to make proper use of them. Yes, we have some support, World Bank support, to be able to do some of all these things and also improve our primary health care as we move towards universal health coverage. So in terms of cost, I don't know what you mean by the cost, financial cost. There's some resources that are being pushed in. We are also re-engineering the system to make the system more efficient and also deliver better services, even at the same cost or at a lower cost. So those are the areas that we are looking at. So we're going to expand. We're going to buy equipment to equip them. We are going to recruit additional skilled staff and change the management system at that level to make it function more properly. And talking about brain drain, I think we need to celebrate the people who are here. And that's why Ghana Health Service, between 28th and 29th of November, went to do the Excellence Award for our deserving staff. And I'm hoping that our media will broadcast and also get the private sector to support us to be able to award these hardworking health workers. We've started them, we awarded them in the district at the regional level. We are going to do a national award, and we hope that the media will help us. And also, like I said, let us celebrate those who sacrifice to stay. Thank you very much. So I'll call Kezia and then to also answer specifically what they have to add. Thank you.
Thank you very much, DG. My question was on the malaria vaccine. The age range remains the same. Currently, the vaccine, I'm looking at the Director of Public Health, who add on if I miss anything. But currently, the vaccine is for children under 2 years, and it hasn't changed. What we are going to do is expand the districts that will be benefiting from the vaccines. So I call the Director of Public Health will add a few words.
Thank you very much. So the malaria vaccine, currently now what we are using is called the RTSS. So you give 4 doses. So you give 6 months, 7 months, 9 months, and originally it was 24 months, but now it's been given at 18 months. So 6, 7, 9, and then 18 months. I think that there was also a question about the black fly. Yes, let me say that Greater Accra is not an endemic region. So once in a while you get these flies, but let me say that the fact that you get the flies does not mean that you can transmit the infection. So now what they've done is that they've taken some of the flies to find out whether they have the parasites in them. Thank you.
Please, if you have any questions, we can take another round. But if there are no hands, I'll call DG back for his concluding remarks. Any questions? Okay. Yes.
DJ said World Bank will support this network of practice policy. If you can tell us how much is it coming? I'm more interested about this, if you can tell us. And I also asked, when is this policy going to be fully implemented? If you can tell us when it's going to be implemented. But I have a third question. It's not about this program. I learned yesterday the UK Health Secretary announced a package, 210 million pounds, and to support 25 countries, including Ghana, to tackle antimicrobial resistance. I don't know whether the Director General can tell us something about it, how Ghana, because Ghana is going to benefit, how much is coming in to support this antimicrobial resistance. Thank you.
Okay, please, if there are any questions, this is the best time to ask. If not, I will invite DG back for his response and his concluding remarks.
Thank you very much, Honorable Deputy Minister. You are from which media house? GNA. See, you heard the UK one, but I didn't hear when Parliament passed, approved the primary healthcare package for this we are talking about. So, since you didn't listen, Parliament approved World Bank facility of $150 million for that, and that's what we're going to use for that. So I think that answers your question. Yeah. Yes, we've started. We've been working on this for a while. We finished a pilot. We are currently even doing some regions. And the good thing is that not only this facility, the system, the approach is so attractive that we have a lot of our partners who on their own have identified districts that they are going to support. So it's already ongoing. And we are also going to start very soon. There are some of the renovations and upgrade and refurbishment of some of our health centers to be able to do that, while we continue engaging other partners like health insurance, our private sector, our chiefs, community. We're working a lot with our regional ministers to ensure that this is not just a structure, but it's a system that we can all live with. So we've been here we want to thank the Ministry of Information for this important platform, for us to give that opportunity to come to the public to share these important strategies with. We will continue as a service to do our best, improve healthcare across the country, but we need the media to also support us to do this very well. Tell us when we are going wrong, also praise us when we are doing well. That will encourage us to do more. So with this, thank you very much and you're welcome. We hope that you go and share the messages properly. And then we are also available for any follow-up discussions where they need. Thank you very much.
On behalf of the Honorable Minister for Information, Kojo Oppong Nkrumah, DG and your team, we have no words. Thank you so much for making good use of this platform. You have been one of the most consistent agencies when it comes to providing the public with information. You are so accessible, and we don't take that for granted at all. So thank you that once again, as you launch this new innovation or this initiative, you have found it necessary to come and engage the Ghanaian public. Thank you. Our friends from the media, as you heard from DG and our respective speakers, please, we are counting on you to send the message out there. Let us do our part in educating the public so that they can really take advantage of some of these initiatives to better themselves when it comes to healthcare delivery. Ladies and gentlemen, thank you so much for making time for this important exercise. See you again. Good afternoon.